When it gets this cold outside, it can take just mere minutes for frostbite to set in, especially if the wind is blowing.
It could just be in the 20s, but if you're not wearing proper clothing, you're out there too long, or you get wet, or you have cardiovascular disease, so your blood flow, your circulation is not as good, it can still be bad too.
Dr. Jamie Belsky is an emergency room physician at Billings Clinic. She tells me they've seen an uptick of people coming in with frostbite.
So when you look for frostbite, you're looking for a couple different things you can look at. So when you look at your fingertips, you're going to notice they're going to go white. Sometimes they're going to go blue and purple as well. You may start to get some numbness and tingling in the fingers.
On the far left is skin without cold damage. To the right, you see frost nip, a mild frostbite that irritates the skin, changing the color followed by numbness. With a superficial frostbite, the skin feels warm and a blister may later appear. And to the far right is deep frostbite, where joints or muscles may stop working and the tissue turns black and dies. In the case of a mild frostbite, you can gently warm the area in a sink or bath, gradually increasing the temperature. But you should seek medical attention if you experience signs and symptoms of superficial or deep frostbite, increased pain, swelling, inflammation, or discharge in the area that was frostbitten, fever, or new unexplained symptoms. You should seek emergency care for hard, cold, blotchy skin, and especially if you suspect hypothermia.
Is when people start to get uncontrolled shivering, like they really can't stop, or they start to get confused. Their mental status will change. They'll either start slurring their words, they'll have repetitive questions. When they get to that point, that's when you need to come see me and say, hey, we need to get some treatment for this person as soon as possible.
Belsky says that the very young and old, diabetics and those with cardiovascular problems are at greater risk of frostbite. Her advice, stay in if you can until it warms up. In Billings, Russ Riesinger, MTN News.